Hello and welcome to lecture M6.6, How the Internet Has Changed Communication Online. My name is Eric Clark, and this lecture applies to students in Dublin, Bahrain and Penang. The learning outcomes for this lecture are as follows. To understand the impact of the Internet on patient communities, to understand the principle of open access patient data, to understand the issues regarding the quality of data on the Internet, to understand the impact of the Internet on medical education. In this lecture there are 4 papers loaded to Moodle. Now again, I have said this in a previous lecture that these papers are not to be understood in minute detail, but you need to read them and to gain an understanding of the core concepts. The first paper is from the Journal of the American Medical Association, and it is the Internet ushering in a new era of medicine. Now, this paper is from 14 years ago, but it doesn't really mean that it's out of date. And I want you to consider the basic points that it makes. And I think, interestingly, you could apply a lot what it says to any of the more recent technologies, including social media. And while you're reading this, think about how you use the Internet when you or someone you know might be sick. Have you used the Internet before when you feel symptoms coming on, or have you made reference to the Internet? So think about how you might use the Internet, or may have used it in the past. The second paper is from the BMJ, the British Medical Journal, and it is entitled How Google is Changing Medicine. Then there is a research paper from the BMJ, Googling for a diagnosis, the use of Google as a diagnostic aid, an internet-based study. And this is a very interesting study where Google is actually used to see if a correct diagnosis has been reached. And then finally, the impact of e-learning in medical education. And certainly you could take the word medical or engineering or anything else and use them interchangeably there. It's not just about medical education. So you need, as I say, you need to read these papers and gain a general understanding of what's been said in them. There are 5 general topics to consider when studying this lecture. The Internet and medicine, building a community for patients with rare diseases. So just think about that. What might happen to somebody if they were 1 in a million or 1 in 10,000? What would they do? We're looking at the National Library of Medicine's website for physicians and patients. We're looking at the access versus quality assurance, and that's what some people call an e-health conundrum. We can get access to lots of information, but how good is that information? What some people would call cyber medical skills, and how to find this information, how to digest it. Repeatedly people say, I'm not much of a computer person, but indeed we all have computers all around us. And then medical education on the Internet, and people claims that this changes everything. I'll leave you to make that decision yourself over the weeks, months and years to come. And really what we're looking at here is communication, reference, quality, skills, and then ultimately education. And there is a mixture of this going on online with regard to healthcare information. So in the lecture, there are 4 links. The first is to a TED Talk, which I'll talk a little bit about in a second. There are links to MEDLINE Plus, PUBMED, and the British Medical Journal. And in the lecture, as I said, there are these PDFs, and there are the slides which I'm talking through right now. This is a bit of a screen grab, so apologies, that shouldn't be there. So all of these resources are laid out in the folder in M6.6. So let's think about building a community for patients. The Internet, no doubt, has transformed the definition of community for a patient with a specific disease, what they see as a community. It's no longer based maybe on the clinic they attend or the support group they physically attend. We now have a situation, websites, bulletin boards, chat rooms, all so forth, so on, where people can get online and feel part of something bigger, feel that they belong to something, but also, most importantly, have a medium to voice their feelings. And those feelings very early on in somebody's diagnosis can be of alienation, apprehension, bewilderment. People are frightened generally when they get very bad news, or news maybe that they don't fully understand yet. So it's no wonder that people flock online immediately when faced with a healthcare problem. Now, I'd like to give you a good example of this. This is my friend Sue. Sue was diagnosed, good friend, I've known her most of my life, diagnosed with breast cancer in 2005. So more or less, Sue has been under direct medical care for nearly 10 years now. But Sue is not the type of person to sit around and do nothing. Sue is quite vocal. Sue is very organised. Sue has lots of friends. Sue is what you would call a classic networking type of person. So Sue's published a book where she collected positive stories from cancer sufferers to help other patients stay hopeful. And there is no doubt that all medicine is part of it is other people's stories, how they coped, what they did, how they faced their fears, how they overcame them. And Sue didn't do this by half. She had 100,000 or 10,000 copies printed, and they were distributed free via St James's Hospital, a big hospital here in the centre of Dublin, and other oncology departments in Irish Hospital. Sue has raised over €30,000 for cancer research and has bought oncology equipment for the department in St James's. So this is a person who was diagnosed and then entered into the community of other cancer sufferers and support people in the support network, did something, changed people's attitudes, helped to change their attitudes, and raised money in the process. So Sue went about this with all the energy that she throws into pretty much everything. And of course, how did she do this? It's a little while ago, of course, 2005. Sue used social media. Of course she did. She promoted this as hard and as heavy as she could through her friends on social media. But that's nothing new to us to a degree in the context of you seeing a patient or you engaging with your patients. And here we have a breast cancer charity that is close to our own professor of surgery. He's heavily involved, as indeed are a lot of staff here in RCSI. Fundraising, awareness, education, research, education, awareness, fundraising. You see those central tenets of what's important for this type of endeavour. And this is one of my colleagues here, Claire. I know this lady well. So, but look here, Twitter, LinkedIn and Facebook. So what I would advise you to do, if you haven't done so already, is to tune in to some of these organisations via social media and just see what they have to say and how they say it. What kind of things that this organisation posts on Facebook or Twitter, whichever space you're in, go tune into them. And keep an eye on the language they use, the type of information that they publish, the frequency that this information is published. It is very informative, and you'll see how these people approach and use social media. And I think it's quite important to understand how others are using these tools to promote their goals and their agenda, and of course to fund research, to educate, to raise awareness, and to fundraise. So think about the community for the patient, no longer limited to physical face-to-face meetings, telephone calls, or indeed postal services, which is some time ago, but that's the way it was done. So we're freed up to a degree. And it's important to see that people may feel vulnerable or indeed neglected when first diagnosed. They can feel a little bit marginalised from the population. And now at their fingertips, they have the tools necessary to relieve fears and answer questions about their specific disease. That's potentially what can happen. This is immensely powerful. And of course, power, I think it's Spider-Man, is it? With great power comes great responsibility. And this is a vital tool for communication and education. The key thing here, the critical thing, is accurate and current health information, and to advocate that patients look after themselves, they feel on top or part of their own healthcare. Now, the fundamental advantage here is that we can connect people, and that may seem like pretty much a no-brainer. Of course we can connect people, but we need to find ways to connect people where we have this accuracy and currency about the information. It's quite easy to connect people if they're fans of music, or if they're fans of a particular chef or artist, wherever it might be. That's a pretty loose group. People may be a bit fanatical, but what we're talking about is, as I say, vulnerable or scared people, and they need accurate and current information. So the downside here, perhaps, where you need to look at this, is the demands on the time of the healthcare professionals providing this care often leaves gaps. And this is one thing patients will complain about time and time again, is the lack of time, face time in front of the healthcare professionals they have. They wait, everybody's busy, they turn up, and they feel like they haven't been given enough time. Support groups for patients can compensate for this lack of education and support services. Now, lack might be too strong a word, in that the support group can maybe extrapolate or tease out the experience with the healthcare professional and provide this kind of support. So it could be websites, apps, or whatever it might be. We're looking at a channel for communication, share practical ideas such as, did you feel sick after the chemotherapy? What could you eat? What made you feel less nauseous? That kind of thing. I don't feel so good today. I feel down. What happened to you? And I'm on X or Y type of treatment. How did that work out for you? And don't underestimate where people can share this type of information with other patients, how powerful that can be. And that's not something they do when they come to the clinic. It's something they can do at any time via an online forum. And many charities and support groups are supported by government and are funded to do so. So what happens in the patient interaction with the physician, a lot of complex information is conveyed very quickly. And in the community, people can ask, well, what was meant by that dosage? What does the word chemotherapy actually mean? What is radiotherapy? And of course, for the physician or the healthcare provider, these are tools of the trade. They know what they are. And people in vulnerable positions will listen, but may not take the full implication of the information in at the time. And these communities can explain information to each other. Now, of course, there are pitfalls, and there are many. What does it cost to run these communities? Do we have privacy? Very often people don't want to reveal their identity. It's quite important. Their healthcare is a private matter. And then the potential for fraudulent behaviour. People giving fraudulent advice, which leads on to constant attention, because what we don't want is bad quality information. So whereas these communities can work well without supervision, they work even better with supervision, but a cost that implies cost, or monetary cost, or cost in time, in that somebody needs to be there to moderate and to input correct advice to make sure that we don't end up with bad quality information. Look, it's a fact of life that patients will go to Google. In fact, you will all go to Google. I go to Google. That's what we do. But where do we start? And we did this in an earlier lecture, millions of hits and all that kind of thing. We put into PubMed, or we put into Google, and Google Scholar, we get different amounts of information. But think of this scenario: a patient walks into the physician's office clutching a sheaf of computer printouts from the internet. They spent the previous evening surfing the internet for the latest information on a particular disease. And the patient is prepared to barrage, to fire this information at the physician with questions. What does this mean? Why can't I have this treatment? Is this drug available? and they're all perfectly valid. But it's also possible that the patient brought misinformation, incorrect information. So how is that handled? What to do? Well, one of the big things that you can't do is to dismiss the patient and say, well, no, this you can't. All information on the internet is wrong, or that kind of thing. But we do need to steer people towards good quality information, and this is a small skill, but one that needs to be picked up. So let's have a look at one of those possible sources. And the National Library of Medicine in the United States has spent quite an amount of time and effort on this. Now, there are other sources, but let's just focus on this one. And here is the United States National Library of Medicine. I've taken a screen grab there, and let's just put in some definitions. So the United States National Library of Medicine, operated by the federal government, is the world's largest medical library. The collections of the National Library of Medicine include more than 7 million books, journals, technical reports, manuscripts, microfilms, photographs, a huge amount of information, including some very old and rare works. Amongst other things, there are 2 sites of interest for us in this lecture, PubMed and MEDLINE Plus. And those links are, as I say, on the homepage in Moodle. Now, this is a very recent screen grab I took from PubMed. They have a virtual city called Toxtown, and it's about environmental health, what may be affecting people. We can see power lines there and maybe jet fuel and all that. So they're really putting a lot of effort into trying to disseminate information freely to anybody who wishes to read it. But also, again, look, here we go. How to engage. That's Google+, Twitter, Facebook. If you're on one of these social media sites, why not tune in? You don't have to read anything, but why not follow these people and let some information come to you, and it may, as your career progresses, become more and more important. But let's go back to PubMed and MEDLINE Plus. So what's MEDLINE? MEDLINE, Medical Literature Analysis and Retrieval System Online. It's an international literature database of life sciences and biomedical information. It's primarily aimed at professionals rather than patients, and it covers fields medicine, nursing, pharmacy, pretty much any literature in the biomedical area, and indeed some that people may consider not to be, such as molecular evolution. So a lot of peer-reviewed, good quality biomedical information. And as I say, it is compiled by the US National Library of Medicine, federally funded, freely available on the internet to anybody who wishes to see it. And all of this information is searched via something called PubMed. And here is PubMed. It's not going to win any awards for design, but to me, in some ways, this design is simple and straightforward and really hasn't changed very much over the years. And we type in our query and we get quite a lot of information. So this PubMed comprises of 25 million citations for biomedical literature, life sciences and books. You could get full text, or you may get a link to the publisher. But if an article or a book has been published in this area, you will find it here. And there are other services which we'll get back to over the course of these lectures. So although we're just concentrating on PubMed and MEDLINE Plus in these lectures. So MEDLINE Plus is a website containing health information from the world's largest medical library, the National Library of Medicine in the United States. The site is intended to be used by healthcare providers and patients, so that's critically the point there. And it's designed to provide up-to-date authoritative information. The information comes from the National Institutes of Health in the United States and other federal agencies, professional associations and non-profit organisations. So you've got where money has been funded by government, this information is fed back to Medline Plus and made freely available in a slightly different flavour to Medline. Medline Plus is not the only good source of information, I should state that now, but it's a very good place to start. And I suppose what I'm trying to do is just show you two different types. And if we take a look again, this is a very recent screenshot. Know the signs and symptoms of a stroke. This is very straightforward, very direct language. Back pain, chronic obstructive pulmonary disease, COPD, pregnancy, heart, you get the idea. So we're looking at different types of news, cool tools, videos that, as I say, the language is a little bit different to a more formal or stuffy language perhaps of academia, and because of the large Hispanic population in the United States, it's provided in Spanish as well. So what we've got in here are guidelines and selects the National Library of Medicine select sites that are, and they have their own criteria for this. Firstly, educational, appropriate to the audience. This is not a heavy weight medical, highly technical site. It's appropriate to be read by the general public. It's well organized and easy to use, which I suppose you'd expect the second two here on top of that. But most importantly, it will include sites that don't have any commercial bias. So we're not looking at a site that's trying to sell aspirin or trying to sell a certain brand of medical equipment. We're looking for something that is non-profit. And the advisory board, looking for something that is dependable, and by dependable they mean the site has an advisory board whose names are listed. So we're looking for basically a list of authors. And curious enough, consistently available. It may seem like a rather unusual criteria, but if the site isn't available all the time and it isn't accessible all the time, then it's not reliable, and it's not appropriate if people can't get access to it. And also, if there are links within the site, they have to be maintained. So what we're looking at, educational, consistently available, and well maintained. We'll look back at evaluating websites. I look forward to that in another lecture. So, other content on Medline and Medline Plus, particularly on Medline Plus, with medical dictionaries, hospitals, physicians and dentists, direct links to where these people are and what's going on, fantastic encyclopedias, and consumer information about thousands of prescription drugs, side effects, dosages, so forth, so on. All, as I say, freely available. Now, within Medline Plus, you may have links back to more serious or more academic information, but the patient can choose to follow that in, but that's not the primary purpose of the site. So I've just pulled another screen grab about a half an hour ago. The one I showed you earlier was maybe a little bit old. Medline Plus, here we go, it's changed slightly, and there we go. Almost half of American adults with HIV don't take the medication. Don't forget 3 square meals Americans eat all day long. Secondhand smoke may double the risk, and so forth and so on. You get the idea. There's a magazine they publish, and if you wish, put in your email address and subscribe, and this would be a very good way of keeping on top of medical information. Now, that's all around us. We pick up information from various different sources, but Medline Plus will send you an email intermittently to update you on what's going on, and it's really a fantastic site. Have a good look around, it's well worth it. So, in summary for this lecture, we were looking at these 5 areas, which were communication, reference, quality skills, and education. How we communicate, what we communicate, and what quality is that information that's being communicated, what skills we need perhaps, and what will happen in education. Now, the skills are debatable. Pretty much anybody can use the internet to some degree, but really where we're concentrating is up here around quality and reference. Now you can read that article on medical education. It's an aside to this lecture, and it's more to provoke thought than anything else. So when you've looked at this lecture and listened to what I had to say, visit PubMed and MEDLINE Plus. The links are in the M6 folder, and indeed just put those phrases into Google and off you go. But try and focus onto MEDLINE Plus, because you're going to get a bit more out of that in terms of information that you can readily digest. And search both of the sites using a medical term that you know a little about, or you've heard something about for the first time recently in lectures. Maybe something, a condition that you or a family member have been treated for, or something that's just stuck in your head, or maybe something that you'd like to do when you qualify. So search them, see what's going on. Find, if you can, in MEDLINE Plus, a learning resource that might be useful to other students studying in foundation year, be that chemistry, physics or biology, or something general. And when you find something, please share your experiences on the discussion forum. It's not a compulsory exercise, but I would appreciate some posts here. And of course you mightn't find something that's directly linked to the lectures this month or this week, but you might find something of overall general use for your classmates. Now, we've a really good video, TED Talks. What can I say? They're always very good to watch. Dave de Bronkart, Meet E-Patient Dave, I suppose, a play on the Eddie Murphy movie Meet Dave. When Dave de Bronkart learned he had a rare and terminal cancer, he turned to a group of fellow patients online and found the medical treatment that saved his life. This is really patient empowerment in action. And now he calls for all patients to talk to one another, know their own health data, and make healthcare better, one e-patient at a time. This is really powerful stuff. And you know, the TED Talks, they're 15, 16 minutes. They're usually quite straightforward, very easy to digest, but this is a really particularly good one. I like it a lot. Don't forget to read these papers. As I say, not every single detail needs to be digested and readily served back up. We just want you to understand generally what's going on in the paper. So the last thing I'd like you to look at is the student BMJ. This is a really fantastic resource aimed at students. Now, there's a lot of there's a bias towards the United Kingdom, obviously because it's the British Medical Journal. But what I wish I knew before I applied to medical school. What a great topic. 7 questions you should consider when applying to a medical schools, and so forth and so on. How much study time will I get as a junior doctor? Now, there's a little bit more of a clinical bias, but you're certainly going to find something of interest. And I would encourage you to, at this stage, refine your reading and spend time reading information from sources such as the BMJ, and particularly the student BMJ, just to get you used to the idea of reading formal medical publications. Now, just as a word of warning, you can subscribe to the BMJ. We're not asking you to do that, although it's free for the first year. Just be careful. They're looking for £25 sterling per year. I am not asking you to do this, just merely to visit the website and become familiar with it. So please don't take out any subscriptions based on this lecture, but do take a look at the website. Okay, thank you very much for your time. Post any questions you have on the forum, and please post those resources that you might find on MEDLINE Plus that may be of use to other foundation year students. Thank you very much indeed.